Hello and welcome to the Dental Protection Podcast. My name is Noel Kavanagh and it's my great pleasure today to bring you a new series, Spotlight on South Africa. Dental Protection, as you know, is a global organisation and our podcast channel is too, but from time to time we'll be bringing you a specific focus to a member country for us all to explore. It was actually while watching and listening to last year's South African Ethics for All dental conference that the thought struck me, it would be great to have a podcast series focusing on South Africa dental. And I thought, who better to host this than Dr. Alasdair McKelvie? His clinical background is in general dental practice, where he worked initially as an associate and then as a principal for many years. His association with Dental Protection began quite a while back, initially working as a local dental advisor back in 2000, before becoming an associate dental legal advisor in 2003. Then in 2007, Alasdair graduated from the University of Wales with a Masters in Healthcare Law, and he became a full-time member of the advisory staff in 2008, and is currently a senior dental legal advisor and also the country lead for South Africa at Dental Protection. So Alasdair, thank you so much for hosting this new series.
I know, thanks very much for inviting me to do this podcast. And it's great to be doing something for our global members and particularly shining the spotlight on dentistry in South Africa as well.
Yeah, and, not everyone will know, I suppose, what is, a distinctive to South African dentistry. Certainly, I'm not an expert myself. So what can I ask you, will today's podcast be about?
Well, it was great that you mentioned the 2022 Ethics for All conference, because the theme all the way through the dental conference was on record keeping and making clinical records. Yes. And the subject we're going to talk about in this podcast is back on to clinical records. And maybe we're going to talk about some of the nuances that arise when making records, providing copies of records, and around the general standard of records in South Africa.
Super. Now that sounds really good, really interesting, Alasdair.
So that's what we're going to do. I'm going to be inviting a good friend of mine from the dental scene in South Africa, Dr. Jacobus Bernard, to join us and have a chat today about record keeping. Now, Jacobus, in his own right, is a clinician, but he's also the South African Dental Association dental mediator. And in many respects, he does a very similar job to me, when I'm working for Dental Protection. I'm helping Dental Protection members solve their complaints, the patient complaints, and he's probably helping everybody else who's not a member of Dental Protection solve their clinical problems and complaints as well. So, Jacobus, welcome to the podcast. How are you?
Hi, Alasdair. Hi, Noel. Yeah, thank you very much for inviting me to be part of this podcast. And yeah, I'm well, and I really look forward to share some of my experiences and some of the things I've learned the last 10 years since this wonderful service, the SOTA Complaints Resolution Service, was introduced in 2014. Yeah, so looking back, we've managed to resolve over 4,000 complaints, and so I look forward to really share some of my experiences and what I've learned the last 10 years with my colleagues.
Great, Jacobus. So let's get into record keeping, and I think what we've got to remember is that the sort of things that we help dentists and other oral healthcare professionals fix are a very small proportion of very successful clinical treatments that happen every day. Yet, one of the challenges for us is defending our members and defending them because the records are not really as good as we think they should be or we'd like them to be. And, for years I've been sort of trying to encourage members of Dental Protection in South Africa to improve their record keeping. In mediation, you're not necessarily looking at clinical records and making decisions or handing out advice based on records. But what's your view of the standard of record keeping in general in South Africa?
Yes, Alasdair, like you said, I don't always see the records or request them, but generally I don't need them to resolve a dispute. But somehow you always end up with copies of the records when you start corresponding with the dentist or when he responds to a complaint as part of the mediation process. So most of the records that I see are illegible. I don't know what it is with dentists' handwriting. It's almost as if poor handwriting is a prerequisite to study dentistry or medicine. Then most records include information about procedure codes or accounting information. But what is generally missing is the really basic stuff you need in every record. The why the patient came to see the dentist, the history. Maybe the patient's pregnant or allergic to latex or got strong preferences for metal-free dentistry or dental phobic, previous bad experiences. Then, how the dentist came to his diagnosis. There's generally no evidence of a discussion about treatment options, risks or concerns the patient have, like maybe the patient have work or travel commitments or financial concerns. Maybe the kid is writing exams or have an important sport event, stuff like that makes that needs to be included in the record. And then also, generally, there's no evidence of some financial consent process going on. So mostly what I see is just procedure codes and accounting information, and a strong absence of all the rest. So anyone interested in the records, whether it's me, you, or the HPCSA or a colleague, should be able to find this type of information in the records and should be able to read it.
So I would just completely agree with you. Some of the concerns and the issues that you've raised are exactly what we see as well. I mean, what is it? What is it? Why are we so poor at writing records in South Africa? Because it is a South African problem. It just seems that all that goes in the minimum information that seems to go in the records is all about the transaction, about the procedure codes. Why is it that we're not doing what we were taught to do as undergrads?
Alasdair, I think most of our colleagues would say that they don't have time to make good records. You can't charge any extra procedure code or charge any extra fee for making good records. It's not even like you get a tap on the back from anyone. As long as your patient is happy, you will get away with it. But when you get into trouble, or when someone else has to take over the care of your patient, only then you'll realize that you failed yourself and your patient. And dentists don't realize how important comprehensive records are until they get in some sort of trouble with the HPCSA or a lawyer, and they have to forward copies of their records. So in short, I think it's just a plain bad habit and a lack of training.
So, Jacobus, let's talk about procedure code 8101, because this is the examination code, and there is a narrative. If you look at the SADA coding book, there is a narrative under 8101 that says what you must do to be able to claim 8101. Can you tell us a little bit more about what's in there that most people don't realize?
Okay, so for our foreign listeners, procedure code 8101 is a procedure code that you charge for oral examination, and it's probably the commonest procedure code charged by dentists after seeing a patient. So if you read in the procedural guidelines, it says that 8101 is an assessment performed on a patient to determine the patient's dental and medical health status. And it involves a diagnosis and a treatment plan of the soft and hard tissue. But what it also says is that the findings of a full mouth examination, including a complete dental charting and treatment plan, must be recorded accurately and legibly on the patient's record. So to charge this procedure code, you have to include the following in your records: your findings, the necessary periodontal and dental charting, your treatment plan, and you have to do this legibly and accurately.
Jacobus, okay, if we just think about this for a minute. So there's an examination, and part of the examination is gathering information about the patient. and then there's an activity associated with the gathering of that activity, and it is recording certain information. Let's just call it clinical data in the record. Now, you often hear dentists will say, I don't earn anything with the pen in my hand. But what I'm seeing here from the narrative under procedure code is that actually part of the payment for the examination that you will claim includes a payment for writing the record. Is that what you understand?
That's definitely what the procedure code says. One half is doing the assessment, and the other half is to write down your findings and chartings and the treatment plan legibly and accurately in the patient's record.
There is some new guidance that's been released by the HPCSA. So they've updated their guidance around record keeping. So we've gone from the 2016 edition, and I think it's booklet 9, Cobus, and there's been an update, and there's been various things that have changed. But my feeling is that there is a renewed focus on improving record keeping from some of the changes that have taken place. Have you seen this booklet, and are you aware of anything that's different?
Yes, Alasdair. Yes, so the booklet 9 provides some specific guidance on record keeping, and it was amended in September last year. And if we can just look at the most important aspects of this amendment is first the definition of a health record, which is a longitudinal collection of the individual's personal and health information. Then the primary purpose of a record is it should be a reminder of what was found, decided and done to ensure continuity of care and provide evidence of the standard of care. Then what was included from the previous 2016 version is there is a mandatory section which stipulates certain aspects that must be in the record. And just to summarize that, is the personal information of the patient, the history, like I mentioned earlier, the time, date and place of the consultation, the assessment of the patient, your proposed management of the patient, any medication and dosages, which I guess includes local anesthetic, details of any referrals, the patient's response to the treatment, any investigations or referrals, and then lastly, written proof of informed consent. So this is mandatory and should be in every record. And then there's certain rules or principles about the records, which says that records should be contemporaneous and have integrity. So they should be accurate, legible, regularly checked, and then of course be accessible and securely stored. And then lastly, what's important is that late entries and additions are allowed, but they must be dated and signed in full. So that's about what I thought was important in these amendments, Alasdair. I don't know if there's anything you want to add.
Well, I mean, I can see with all the mandatory information, the eyes rolling to the back of everybody's heads, because, when you read that list, it actually looks like you'll be writing chapter and verse on record keeping. But, once you get good at record keeping, it doesn't really take you that long to add all that information. And what's clear here is they're saying is that someone else can write the record for you, so that with a bit of training, you can have your dental assistant make the record while you are gathering the data. Is that something you do when you're in clinical practice?
Alasdair, I personally prefer to write down my own records while my dental assistant cleans up the surgery but I guess it's just a personal thing, and many dentists will differ from me. Can I ask you something about records, Alasdair, which is something I deal with often with the mediations?
Sure.
Is patients often request the records once there's a dispute and the patient loses confidence in his dentist, his or her dentist, and the professional relationship is broken. or compromised, then this patient requests copies of the records. And then often dentists are reluctant to provide copies of the records because they argue that the patient's account is not settled and there's some money outstanding. So how can you forward copies of x-rays and the records to a patient that haven't paid for those x-rays? I mean, what's your experience with things like that?
Thanks for that really, really easy question, Jacobus. But my experience of things like that, you've got to separate the two issues. The patient has a right to access their health information, a statutory right. And I don't think you can say, well, they're not entitled to the records because there's an outstanding account. I think really if there is an outstanding account and the patient wishes a copy of the records, then you've just got to say to the patient, let's do things properly here. You've got an account to pay. That's for treatment rendered. I know you want copies of your records and I'm quite happy to give them, but can you also settle your account, please? But I don't think you can use the outstanding account as leverage not to release the records. I don't think that's possible. I think that a clinician would be criticised, and you've just got to be a little bit more innovative about how you collect the outstanding debt. But, you know, you've also got to get into the mindset of the patient. And, you know, there's usually a reason why there's an outstanding debt, and it's usually because they're unhappy with some aspect of the treatment, or they've got an account that they didn't expect and that wasn't discussed up front. And I think that it takes us away slightly from record keeping, but debt collection is an art. And I think you've got to make sure that before you hand over anybody for collection, that you as the clinician contact the patient and find out why their account remains unpaid and give them the opportunity to tell you. And generally, once you do that, you can find out what the problem is and address it there if there is one, or provide the patient with the explanation and say, look, we'd really appreciate you settle your account by such and such a date. Otherwise, you leave me with no option but to hand it over for collection. But that is a completely separate part of the business of dentistry from the disclosure of records. So that would be my advice. I mean, I'm assuming in your role as mediator, you often get clinicians calling you up and asking you questions about things like how long do I keep the records for, that sort of thing. Do you get any sort of, apart from the question you've just asked me, do you get any other sort of queries, Jacobus?
Yes, Alasdair, there's quite a lot of questions about how long you should keep the records, and then that's also very well described in the amendments made by the HPCSA and to Booklet 9, and it says that ideally health records should be kept indefinitely, and if it's not possible, at least 6 years from the date the file became dormant, and of course children until they're at least 21, and mentally incapacitated patients, of course, for a lifetime.
Yeah, and I think that what's really good about the new guidance, Jacobus, is that it actually sets out who the record belongs to. And the actual physical record belongs to the clinician, to the dentist, and it's the information contained within the record, that's the patient data, that information belongs to the patient. And that's why you have this sort of problem about when patients ask for records and they ask for their x-rays, and you know there's an idea that they've paid for that and it belongs to them, but in essence the actual physical record and the information that's written in that record, that bit belongs to the practice and must be retained by the practice. And the patient is entitled to the information that's recorded in that record, but not the actual physical record itself.
You know, for me, Alasdair, just to summarize about record keeping, you know, someone from the outside, like the HPCSA or lawyers, can't look into your patient's mouth to understand what's been done and if it's done to an acceptable standard. But detailed notes will probably suggest to the person reading them that high quality care has been offered, whereas poor and illegible and incomplete records are more likely to reflect a poor standard of care and that there was very little to write down rather than a high standard of care but poor records. And that for me just summarizes the importance of good records. You can't really separate good clinical treatment from good record keeping. They kind of go together, like that description of procedure code 101 we talked about earlier.
Yeah, I would agree with you, and I think the other thing that we want, the other message that we want to get across about record keeping is, Jacobus, is that, in all walks of life, people keep records. So, your banks keep a record of your transactions. When you go and see an attorney and you give them a statement or whatever, they make a record of that. Professional people all over the planet are making records because it's part of what they do, and it is a sign of professionalism. And I think that the courts will always look at the standard of record keeping as a kind of proxy for the quality of care as well. And that's why not only are your records, the quality of your records, important for the management, for this kind of long-term clinical journey, but they're also a marker of you as a healthcare professional. So I think it's important to state that as well, because, everybody thinks that making the record is the burden and we don't have time to do that. And I can see all that when maybe 99.2% of all the records you write every year don't really matter and you never refer to them again. But it's that sort of 0.8%. If it's not good enough, cause you immense problems, cause your indemnifier immense problems, and even cause the patient problems. So with those kind of summary points, Jacobus, I think that we've probably reached the end of our first podcast in the Spotlight on South Africa series. If you'd like a certificate for listening to go towards your CPD, or to learn more about what we covered today and who you were listening to, please do take a look in the podcast description. I've been your host, Alasdair McKelvie. My guest today has been Jacobus Bernard. Thank you for listening.